topic is chronic pain management. And we'll talk about the pharmacological as well as non-pharmacological treatments that are used. And we talked already about opioids last time I was here. So we're not going to talk about opioids because it's not really a good choice for chronic non-malignant pain. So we're going to talk about some of the other medications that are used in chronic pain management. The objectives of the talk are to learn what medications are used in chronic pain management. And believe me, you don't want to, unless it's cancer or AIDS, and there's a lot of pain involved, where there's destruction of tissues involved, you don't want to go to where opioids are. And then learn what non-pharmacologic strategies are for chronic pain management. And among the non-pharmacologic strategies, we're going to learn about surgical procedures, as well as regenerative medicine and alternative and psychologically based treatments. But my favorite is lifestyle treatments, and that's what I employ in my when I work at my pain clinic, which is Pacific Rehabilitation Centers. Now, overall considerations and goals. Remember that when we're dealing with chronic non-malignant pain, that is, if it's not cancer, if it's not AIDS, if it's not rheumatoid arthritis, so there's no destructive process causing the pain, complete pain management, complete pain elimination is possible. All right, but that does not necessarily improve function or quality of life. For example, we can put somebody into completely painless state, and that's called general anesthesia. But you're not going to have any function, and you're not going to have a quality of life under general anesthesia. In fact, you will be totally unaware of what's going on. So the goal is not necessarily to eliminate pain, but to reduce its impact on function. And as you do so, you will find in many cases that the pain becomes much more livable, something that you can actually function very highly despite having the disability of chronic pain. In other words, it doesn't have to contract your life. All right, so if you have any questions during the talk, feel free to just go ahead and ask, but there will also be time at the end if you think of questions. Now let's look at some pharmacologic strategies to fight pain. You want to fight pain on several fronts. One of the fronts is to reduce inflammation, because what goes on when you have a damaged area, let's say your shoulder or knee is damaged, there's inflammation that occurs. And the purpose of the inflammation is to let the healing cells, like fibroblasts and other cells that heal, come and take away the debris. The macrophages do that. And then the fibroblasts come and they knit new tissue together. Now, it's all well and good to have some inflammation, but a lot of times in a chronic pain situation, the inflammation is ongoing. And so we have medications that reduce inflammation. Another type of medication reduces the conduction of pain. In other words, the transmission of the pain signals. And it's important to realize that pain is not in your head, but your head does produce pain. It becomes an output of the brain. And if you can reduce the conduction, that output that the brain puts out and that you experience as pain can certainly be reduced. And then the third pharmacologic strategy is to improve tolerance. So probably the biggest category is anti-inflammatories when it comes to non-malignant chronic pain. And I list things like ibuprofen and naproxen and celecoxib, but probably the most potent anti-inflammatory is something that your body produces, and that's the corticosteroids. They have potent benefits in reducing pain, redness, swelling, fever, and some studies show, like the nurses studies show, that it could protect against Alzheimer's disease. Risks include gastritis, esophagitis, bleeding. Esophagitis is like what happens when you have GERD. Heart attacks can happen, strokes can happen, and if you take chronic on a long-term basis, you're at risk for renal failure, hepatic failure, and anaphylaxis. Hepatic failure more with Tylenol than with the non-steroidals. Any questions so far? Now, an effective medication for reducing pain transmission are anti-epileptic drugs. And because they decrease the activity of neurons or nerve tissue, they can actually reduce pain transmission, such as, examples of such medications include gabapentin, pregabalin, and carbamazepine. Now, they can help with the shooting pain that people have with like sciatica. It's useful in diabetic neuropathy, shingles, and trigeminal neuralgia. That's really severe facial pain that feels like it's electricity in the face. Now, the risks are, because it slows down neuronal tissue, it can kind of give you mental sluggishness. It can give you weight gain. And of course, you can get allergic to it. And some of these, such as carbamazepine or Tegretol, it can be tough on the liver and bone marrow. So you have to constantly monitor blood counts, and then also check the liver function from time to time before you start treatment and then during treatment. And then when it comes to helping tolerate pain, antidepressants can do a fairly good job. And the reason they do that is because if you have a negative outlook on things, pain always feels worse. And so an antidepressant can actually help you feel better. It can also reduce the threat value of the pain. Because if you are thinking that the pain is causing all sorts of havoc in your body, the threat value increases. And so the when it works in the limbic system, these antidepressants can help you feel less threatened by the pain. Venlafaxine or Effexor is commonly used. Duloxetine is one of the favorite ones. Trazodone is used a lot for sleep, and they can help with pain reduction, improved mood, reduced anxiety, improved sleep. A lot of these have pretty bad side effects like nausea, vomiting, diarrhea. Now, some people don't have as much, and so they tolerate it. Some other side effects include weight gain, and a lot of the SSRIs and SNRIs can cause loss of sexual functions, such as loss of libido and ejaculatory disorders. All right, so now we're going to talk about non-pharmacologic treatments that you may have had if you have chronic pain. Injections are used, and a lot of times they're corticosteroids. They're potent, as I mentioned earlier, they're potent anti-inflammatory medications. However, whenever you do an injection, here's a picture below here of injection into the spine, you can have bleeding, and you can also have infection. And the big thing that you see sometimes is that it just doesn't work. There are surgical procedures for chronic pain, and some of them are based on the gate theory. And the idea of the gate theory is let's say you have a gate, and let's say pigs represent pain signals, and the pain signals go into the gate. Well, if you can bring in some cows that block the gate, then you won't have as many pigs going in. So that's kind of like what the gate theory is. It's gate control. And the idea is that you use electrical stimulation along the nerve axis, and it works on the spinal cord. You can work it on the peripheral nerves, but that's not a surgical procedure. It's just called transcutaneous electrical nerve stimulator, or a TENS machine. And you can just buy those for $50 and without even a prescription. And you can just put it on the area where it hurts. And that can distract you enough to kind of relieve the pain somewhat. But the surgical procedures that use gate theory are spinal cord stimulators, motor cortex stimulators, and deep brain stimulators. And probably the one that has the most success appears to be spinal cord stimulation. Of course, there's also medications that are delivered surgically. But another thing that neurosurgeons do is neurolysis, where they actually destroy nerve tissue, and they try to be very careful to make it just the sensory nerves. But sometimes you can have other problems with these procedures as well. Any questions about surgical treatments? And, of course, if injections have the risk of bleeding and infection, you can be sure surgery does as well. Regenerative and gene therapies, they're sort of being investigated now. Such methods as platelet-rich plasma, stem cell therapy, gene therapy. And the problem is they're not proven yet. So there's anecdotal evidence that people feel that they feel better with it, but then they're also very expensive. And there's also the placebo effect. If you do anything, some people feel that it's really, really helping. And whether it helps or not, we really don't know. Risks, again, include infection and bleeding. There are alternative and psychological treatments, such as acupuncture, massage therapy. The picture here with the feet is reflexology, and that's sort of like, I think all these treatments have a component of placebo effect in it, except for massage. Massage actually does help because it improves circulation. And then herbal medicine, naturopathy, and homeopathy, and then cognitive behavioral therapy. There's a huge connection between mind and body. And if you can get somebody to look at their pain differently, it can make a huge difference on how much it distresses them. If they can look at the pain as not something that harms them, but something that they have to fight and they can successfully overcome, then they do much better. Lifestyle treatments is my favorite topic, and this is what I actively teach my patients who have chronic pain. First, I talk to them about nutrition. Nutrition is amazingly important, and we'll get into it a little bit more. We don't have time to go over all the aspects of nutrition, but we'll talk about nutrition, exercise, hydration and hydrotherapy, avoiding toxins such as caffeine, tobacco, and alcohol, and drugs, which increase pain. Breathing techniques. I was so happy that you talked about some of these things earlier, and I really appreciated Shadana's presentation on massage. That was really, really good. Thank you, Shadana. sleep, and then finally trust in divine power. So let's go over some of these. The benefits are that they're inexpensive, they're accessible. You don't have to go see a doctor to do these things, and they are effective. And there are absolutely no risks in practicing these lifestyle treatments for chronic pain. In a word, a whole plant-based diet can help you. If you restrict your diet to whole plant-based, you're going to have a lot of anti-inflammatories in your food. And not only that, you will maintain healthy flora in your gut. It will help you feel better, and it will improve your mood, improves circulation, and removes metabolic wastes from your body. By eating a lot of fiber, for instance, all that cholesterol that mucks up the circulation, because circulation is absolutely essential to getting healing in your tissues. That's why massage works so well. If there's too much cholesterol, you can remove it actually from your blood vessels using a high fiber diet. Exercise is so important. At first, people are like, well, how can I exercise when it hurts to move? Well, guess what? One of the treatments is to change that false belief that movement actually harms you. And when it comes to chronic non-malignant pain, and you've gone through all the MRIs and all the treatments and all the investigations, your doctor hasn't completely treated you until your doctor tells you it's okay to exercise. Because unless you exercise, you're not going to get the strengthening that you need to improve that joint control. You're not going to get the additional benefits of even more blood flow. So you can start out with gentle stretching just to show yourself it's okay to move. And then as your pain improves, you can start strengthening and then do sport-specific exercises. It improves circulation, healing, maintains flexibility, strength, joint mechanics. And it's just so many benefits to exercise. We can't list them all here. Hydration, water inside and out. So water can cleanse metabolic wastes. It can lubricate your joints and tissues. And that's if you take it inside. Now, outside, you can use warm compresses, cold compresses, ice. It can decrease pain and inflammation. And getting plenty of water is essential. Health benefits of sunshine. Sunshine is a rich source of vitamin D. It reduces risks of cancer, such as pancreatic cancer, colon cancer, ovarian cancer, prostate cancer. It improves your immune system, and it is great for mental health because it helps you produce serotonin, and then it helps improve sleep because you need exposure to bright lights to make melatonin, which is the compound necessary for you to fall asleep and to stay asleep. If you're having trouble falling asleep, you might want to be exposed to bright light therapy early in the morning. If you have trouble staying asleep, get exposed to bright lights just before sunset. And you can get a bright light lamp. They used to be hundreds of dollars. Now you can get it for a lot less. Another thing that will help is to, this seems so self-explanatory, to avoid caffeine, tobacco, alcohol, and drugs, because these are neurotoxins and inflammatory chemicals inside your body. In fact, 1 cup of coffee will double the inflammation in your body. And we did tests to show that the marker of inflammation doubles with just 1 cup of coffee. And if you smoke 1 packet of cigarettes daily, you're going to have triple the spinal pain as somebody who has the exact same spinal condition as you do. Maybe even more than triple, but at least triple. Alcohol and drugs also impair the most important organ that you have to fight pain, and that's your brain, because your brain is what is necessary to figure out how to deal with the pain in a better way, how to fight the pain and get that pain reduced and get on with your life. Breathing, sleep, and recreation are also essential to getting your pain under control. Taking deep breaths and recreation and sleep reduce tension. And then, of course, the deep breathing helps with oxygenation, which is necessary for your health. And by the way, you probably already know this, but healing occurs when you sleep. And if you're wondering why you're not healing, it might be because you're not sleeping enough. And it's really important to get rid of your devices. Take them outside of your bedroom. Bedroom's only for sex and sleep, nothing else. So get your devices out of there. Healing occurs during sleep. Sleep and relaxation helps promote trusting God. This is, in my mind, the most important because when you put your trust in God, you're not going to have anxiety. You can cast your cares on Him. You'll have a joy and a peace that the world cannot give. And despite the problems that you face, you're going to have hope. And we already know that prayer actually has health benefits. And so these are lifestyle treatments that really do help with pain.